Okay, Natalie, so what we did today was we went ahead and disclosed your teeth with the dye. What the dye does is it goes and it tells us basically where we can see biofilm and biofilm plaque, which you may or may not have heard of. We'll go over that in a little bit. But before I go over this with you, I do want to just ask you, how does your usual oral routine look like? How long do you brush? What do you use?
So I use a regular toothbrush.
Okay.
I feel like I brush for about 2 minutes, but to be honest, I don't think it's that much. I don't really floss that often. Maybe once, twice a month.
Okay.
Brush in the mornings and at night.
That's about it. Okay, yeah, I know it can be hard to find time throughout the day, especially with your busy schedule, being a student and running around doing homework. It can be pretty difficult to find time to floss. The good thing is you don't always have to floss at night before bed, or you can, carry stuff around in your purse, the little tooth flossers, the toothpicks. But so that's good. So it sounds to me like for the most part, you're brushing, you're just not flossing. There's a couple things that maybe we could improve there, definitely. When we did disclose the teeth, I do just want to show you the chart that we have here. So we have some biofilm buildup. Tell me a little bit about what you know of biofilm, plaque biofilm.
Well, I know what I feel when I don't brush is, or after like a long day right before I'm brushing at night, I feel kind of like grainy or roughness in my teeth.
Yeah.
But other than that, I mean, I don't really know anything or much about it.
Yeah, it's one of those things that a lot of people don't really talk about. We just know this is why we're supposed to brush our teeth. So plaque biofilm is basically bacteria that sits on the teeth. And that's what I showed you here where we saw the plaque biofilm. The biofilm is basically a matrix or a colonization of bacteria in the mouth, which can be normal at times, and that's why we do daily brushing. So we want to make sure we remove all of that biofilm, because the biofilm is what leads to disease. And the disease itself, it can start off undetectable, which is kind of the scary thing about dental disease. Little by little, if you don't brush it off, you will start seeing inflammation of the gums. Could be bleeding when you're brushing. And that just leads to further inflammation, could lead to infection. And then what happens is that dental biofilm, if not brushed off, actually hardens, mineralizes, and that hardens on the tooth and you can no longer brush it off. And that's where you come to me, we scrape it off with the scaler, and so we don't want it to get to that point. And so that's why it's important to see kind of where you're missing when you're brushing, and kind of know that back here is where you're going to get the most buildup, because it's so hard to get back there with your toothbrush. Now, that's the biofilm that's on your teeth. And so that's where everywhere that's red, that's what we found is kind of where you're missing brushing. And the plaque score that we're looking at here with the total of the calculus and the amount of teeth that you have, we're looking at 51%. So we're right there. Well, I know it's a wow, but it's better than some of the stuff I've seen, which just needs improvement. Okay? All right, so the next time that you come in, we're going to show you how to properly brush the teeth, how to properly use a toothbrush to get way far in the back, behind those back teeth there, where we're seeing a lot of that biofilm buildup. Now, from now until the next time I see you, what are some suggestions that you have that you might make, some small changes? Is there anything that you see that maybe we can start implementing and I'll look for in our next appointment?
Well, I think you mentioned something about floss picks. I think you could probably get some of those and use them after I eat during the day,
Yeah.
Probably just try to brush a little bit longer, because I know I'm almost sure it's not the full 2 minutes that I'm supposed to be brushing. So I think those two things I think I would.
Yeah, so 2 minutes will definitely make a big difference. And flossing, even if it's just right after you eat, grab one out of your purse really quickly, throw it away. That'll definitely make a big difference. And so when you come back in, we'll disclose again, and we'll kind of see where we are at, and then we'll go from there.
All right.
Okay? Thanks.